What are bone islands? A bone island is a piece of cortical bone which is isolated in cancellous bone. Hence the name bone island. Since it is made up of cortical bone, we expect bone islands to be very dense and hard with a high CT density. See how it is similar with the cortex? On CT, bone islands are sclerotic, meaning it is very white. There are imaging criteria to call a bone island. First, it has spiculated margins surrounded by trabecular bone. 2. It must not show adjacent cortical break or bone destruction. And 3. It must not have a soft tissue component. If a sclerotic lesion fails to meet these 3 criteria, then the lesion is considered to have aggressive features. Aggressive features are the opposite of the appearance of a typical bone islands. Aggressive features are cortical destruction, periosteal reaction or soft tissue component. Sclerotic lesions with aggressive features are seen in blastic metastases. What are blastic metastases? Metastases means a malignant tumor which came from another organ. While blastic means osteoblasts are activated to create new bone in the skeleton, if the blastic mets show obvious aggressive features like cortical destruction, periosteal reaction or soft tissue component, the diagnosis is pretty outright. But if these features are not seen, bone islands and blastic metastases may look similar. One clue to differentiate them is to measure the CT density. Draw a region of interest to cover the entire lesion. An average measurement greater than 885 Hounsfield units and maximum measurement below 1060 Hounsfield unit is very sensitive and specific for bone island. In this example, we fulfilled the first criteria. We also observe that there are no aggressive features. Of course, before calling it as benign, think about 2 more things. First, is there a primary malignancy which is known to produce blastic metastases like prostate cancer and breast cancer? And second, do you have the benefit of a prior imaging to give you more confidence that the lesion is stable and benign? In summary, a bone island is dense cortical bone isolated in cancellous bone. It may look similar with blastic metastases, and to differentiate the 2 we have to look closely for aggressive features, growth, and consider to look at their CT density.